So let's go to this. Let's define what we're going to talk about. Oh, I skipped over. So we're going to define self-soothing and bonding. And we're going to talk about how to replace avoidances to proper self-soothe. So some self-soothing is avoidances. We're going to talk about little touch on root issues. We're going to touch on attachment and attunement. I'm going to do way more on attachment someday in a whole, that's a whole hour. Nurturing the soul. Let's, what does that mean? How do we nurture the soul? And then tools, and is this developmental timing, how are the tools needing to come in at the right time? And that's all, really up for debate of when and where, like the age of the child. So nurturing, attachment, attunement, tools for kids, it depends on their age. So we can talk a little bit about that, and put in the chat if you have any questions of like, hey, what about this 8-year-old that, they're doing this again and they haven't done that for a while. So yeah. So definitions, we have to define what we're talking about. So self-soothing, it is a regular, repetitive action to regulate emotions. Okay. So wait, that's huge. A repetitive actions to regulate emotions. Well, so we got to learn about emotions first. So that's where I'm going to talk about the emotional coaching, and that there's a whole video on that, and shame parenting and stuff like that. So it's done by the child though, or the kid or the adult. It doesn't matter. We self-regulate emotions by self-soothing. Now that sounds good because I was talking about, oh, do some self-soothing. I don't do self-care. It's self-soothing. So there's good ways to do that, and there's not so good ways to do that. So it's self-soothing behaviors that are often developed in early years of the life of the child. It's very early, and it's most of the time it's subconscious. It's not like something that you think about and you do, right? It's a lot of subconscious stuff, very early development. And it's, it's to calm or comfort. Okay. So when we want all of our kids to be calm and comforted, but this is on their own when sometimes they can't calm and comfort themselves, or someone else isn't. So that's where the attachment comes in, and they calm and comfort themselves in these actions. So it's common for adults to continue these self-soothing behaviors as they develop during childhood. Although self-soothing is a life skill, so this is not a shame thing. It's a life skill that can be very important for emotional regulation and well-being. It calms the nervous system, but some self-soothing behaviors that children and adolescents might engage in may be not so appropriate. Self-injuries, right? Or self-harm. Okay, so that's where I've seen that increase, right? With the stress of going back to school, or, because parent stress, really their energy really is displaced on the children sometimes. So attachment is a form of emotional relational bond. So it's a relational bond that is formed in a very young age. Attachment actually happens 0 to 3. The child finds security and safety with that person. The loss of this person could cause distress. So, if you've had a child or you care for children, that 0 to 3 is very crucial. They have those little, at 18 months, they usually get over like you going around the corner and coming back, or leaving the child at daycare, and then the child says, oh, I'm scared, but I know that person's going to come back, so I'm attached to them. Bonding is a little different. So this is the part where this is actually a bonding mechanism in the brain that happens. And so the brain develops different if the attachment isn't there. So bonding has to form in the attachment as the glue that connects the emotion. So this is all emotion. So how do we connect emotion? This is not about behavior. This is not about, your thoughts. This is not about, this is connecting through the emotion. So that is empathy. So when we bond, Sometimes we hold, we rock, we sing, we gaze, we kiss, and time together and eye contact, and the five senses and all those nurturing behaviors. But the key here is those are all behaviors, but the feeling, the emotion came first, then the behavior. So here's the emotion. I connect with the emotion, which is really deep eye contact and being present with, so that's what we bond with. And the attunement is like a parenting attunement. Dan Siegel talks about this a lot, other professionals, and I have their books referenced in the back of this always, is responding to the cues. This can be taught, it's nonverbal, and it's interactive. So there's not, when we kiss or we have time together or have eye contact, there's no verbal. So now let's talk about adolescence with attachment, bonding, and attunement. This is where we lose bonding and attunement. We don't do very good, because our teen pushes that boundary, and then our job is to hold it, and they push them again, and we don't want to gaze, we don't rock them anymore, and we don't sing to them. But we have time and we have eye contact, and this is all nonverbal. This is we don't need to verbalize. So when the parent comes into me, of course, my teen doesn't talk to me enough, and that's what you sound like. It's like, oh my gosh, and I'm really worried because they just don't open up and they don't interact with me. Well, you've got to be attuned to responding to their cues non-verbally and teach that. So you have to teach attunement too. So yeah. And so bonding, it has to keep going. Attachment, it's formed in a very early age, but it can be improved if it's insecure. So we're going to go over those things. So there's some reasons why we do this, right? So one, remember, it's all about regulating an emotion that we don't really know what's going on. We don't, and don't try to figure it out. It doesn't matter. It really doesn't. We have to just look at that and say, okay, what's going on is I feel this way. Okay, but there could be 50 of those things going on. So just, it's just about self-soothing and emotion. And so the reasons why they do that is they're trying to self-regulate their nervous system. So you have trouble coping or understanding their emotions. So they have self-soothing. The stress, which can be brought on by change. And I have that in bold. Change is what we kind of pull out of like kids. I'm like, oh, so you're overwhelmed when you have to do something and you're not warned ahead of time. So school transition or challenges or changes or adjustments or moving, so change is really actually hard for most kids because they can't cope with it because we haven't given them some of those skills and prepped them. But so we do that a lot in therapy and play therapy. But we have current or previous exposure to trauma. This is the reasons why we self-soothe. We have exposure to trauma and we have not processed it. We don't know how to deal with it. We haven't done trauma work early in life, so we do these other things to, you think about when your kid had a trauma, what did they develop after that trauma? They developed a self-soothing mechanism, I promise you, somewhere. So attachment issues, of course, this is why. So when a kid rocks, and I'm going to go through this list in a minute of what self-soothing is, but when a kid rocks that, back and forth, and they rock themselves, that's because they learned to do that when they weren't being rocked or they wanted to be by themselves and not attached. Sensory seeking. So when we're self-soothing, we're doing something there's five senses, right? And so we're doing something in the five senses for sure. So we're trying to figure out sensory. So that's where autism and ADHD comes in, mostly autism. There's lots of sensory issues with kids right now. I mean, I'm seeing so much sensory issues, food sensitivities in food sensories of like textures, right? Other things that are really coming out. Tic disorders. So if you think, it's like, wait a minute, what is, how does that have to do with anything? Well, tic is a development of some self-soothing, maybe some previous exposure to trauma. It's repetitive, it's stereotype movement sounds. It's not common among school-age kids, but it's not uncommon, sorry. On average, tics generally become apparent in 6 to 7 years old, but I've seen teenagers all of a sudden have tics. It's because of trauma. They peak about 10 to 12. So the thing is about all this is, if there's anything genetic going on, and I'm going to bring this up now, I guess. So there's genes in us. All of us have genes, and I'm listening to this summit, and so I'm always like got things on my, the pre-existing belief that a gene is just there. Well, yes, we have genes. We all have genes from mommy and daddy, and we all have genes that are there. The thing is about certain neurological things and trauma is those genes are dormant or they're activated. So when a gene all of a sudden is activated, then this is where this behavior comes out. Now, there's a lot of things that trigger that. And I'm going to go over some of those things. There's things that trigger the genes. So we can keep those genes dormant and they can go away. We can get rid of a chronic gene problem. People can, think about people with diabetes, cancer, all kinds of disorders. It's not a permanent thing for some things. And that gene goes away, you take care of it, you put it in dormancy, you don't have that gene activated anymore. And then you wait and you work on all that stuff. That's sleep and diet and all kinds of things, and stress. Those three things, you reduce stress, you increase sleep, get better sleep, and completely change your diet. Those things, those genes go into less activation. And genes and activation causes behavioral issues in kids. It just does. So when those genes are activated, we have behaviorals in kids. Like I said, a tic disorder will all of a sudden develop after trauma. So these are some of the things. So these are some of the behaviors. So think about, so thumb sucking and nail biting and skin picking. So sucking on stuff, pulling your hair, biting the ends of pencils, breaking, and chewing on stuff, masturbation, drug experiment, self-harm, the cutting, the poking, the burn, I had like eraser, burning their skin, binge eating, bedwetting. So that bottom one, so accidents. You think, well, that's not a self-soothing behavior, bedwetting and accidents. Yes, it is. It absolutely ends up being in that category. We have to rule out other things first, but if it's all of a sudden when they're 7, 8, or 9, and they kind of did well for several years, that's called self-soothing. We're trying to combat an emotion that is scary and unmanageable for the child. So they will pick up on something. They will, start pulling their hair. They will start, banging their head again. So, I had 25 foster kids live with me, and I promise you they had lots and lots and lots of self-soothing behaviors. And they came that way, of course, because they learned how to do that through trauma and attachment, and, they didn't have attunement and bonding with their caregivers sometimes. So they had an attachment issue. And so they learn how it's a defense mechanism. So defense mechanisms say, do something to calm your nervous system. And these things are automatic. And you wonder about, let's talk about self-harm. I have a little bit of that in another video about the difference between suicidality and self-harm. Self-harm is a self-soothing behavior. It usually does not mean there's suicidality, but sometimes it can be combined, of course. But self-harm is, and I don't have time to go into the brain and the actual science behind this, but all you have to know is these things calm the brain when they're doing that. Also on this side of the list, and there's more, I was trying to make sure I have most of them on this list, but I have lots of coping and dealing with anxiety, which is actually next Tuesday. I'm doing an anxiety 101 like tools, like basically here's, and I already have the anxiety one on the YouTube channel, but this one's just tools. So here's anxiety and here's tools. So we call everything anxiety. All that means is the nervous system is activated. So this is all things that the nervous system is activated. I don't know what to do with my emotions. My body's feeling uncalm. So I'm going to do something to self-soothe. So the best way to do some of these is like, so squeeze ball, there's science to this, okay? But the key to this is it's called paired muscle contraction. So if you're going to get a kid a squeeze ball, get two. You're squeezing them together like this. Okay. Anything bilateral, and I'm going to teach you complex in a minute at the bottom here, and any tapping. This is not tapping on the forehead and on the chest. This is bilateral tapping. It's an EMDR mechanism. So to squeeze ball, get two. A soft, cuddly toy. When that kid always has to take 3 toys, everywhere you go, that was a self-soothing thing. And I hope you didn't shame that. I hope you worked on that. I hope. And then once in a while, we go to, let's just take two cuddly soft toys or stuffed animals with us to the store every time we go. That was his self or her self-soothing mechanism. It was okay. Because there was something else going on, right? So we have to decide, it's like, so fidgeting things is really good. A bracelet, I do not, long time ago, there was like this little thing that they said, oh, put a rubber band on your wrist. And every time you think about, you're being activated, you flip it. I don't love it. Don't do it. Just find something to touch. So rings, bracelets, spinners, those help. People, I've had teenagers have little, ring spinners that they just have, and they can spin those. I teach 4 square breathing underneath your desk with, breathing up 4 and holding it 4, and then letting it out for 4, and then waiting 4, and then doing it 4 times. I mean, that's something that you can touch underneath your desk while the kids are like, okay, I'm having stress, and then I'm recognizing that I am, and then I can do some 4 square breathing, So going for a walk, warm bubble bath. So warm and cold, this is scientific also. This is the other part, is temperature. So you want to do cold or hot. And I could put on there ice cubes in the hands, do the same thing. Something to change your state back to, oh, I'm present. These are all present activities. Because if you're not present, then you're into these other ones where you're in your subconscious and your unconscious. You're just, you'll notice a kid just biting their nails or, scratching their skin and picking at their skin, and they don't even know it. It's so just routine. So the other ones these are like, we got to think about it. We got to do this squeeze ball. We got to do some breathing. We got to hit a punching, so then we go, color. So the question is, in the moment, instead of pulling hair, that's when we want a little gadget, right? So we can't always just play with a pet at school or take a cuddly toy or squeeze balls. So I want any of you parents to have something that you can teach your kid in school, anywhere they're at, any place, anytime. It only takes 5 minutes. And that's paired muscles. You don't have to have a ball. So you can just squeeze and let go. Squeeze something and let go. Paired both your feet and squeeze and let go. Calm place is something that they can just close their eyes for a second and go to their calm place and go with their 5 senses and their 5 emotions that go with that. Just find a place. They can draw it. They can write about it. So you can butterfly tap the calm place in. So it's very slow, and you just say, okay, let's find your calm place. This is after you're activated too. These are all things that you can do when a kid's active, after they're activated, after. But this is going to help them say, wow, this is the point of this screen, is I have power over some of this. I can choose to do this when I don't know how to regulate my emotions. So It has a lot to do with that. And there is an emotional regulation class that I'm doing. I think it's at the end of this month. So this goes first. Then we're going to really just go into how do we regulate emotions? Well, it's going to be all these things too on this side. So we don't want to regulate emotions with binge eating and bedwetting and head banging, right? Because once it's over, it's like, oh, I feel better. Well, when we do this side, once it's over, you feel better. So we want to teach the child or any of us that we can do this other stuff and we can prevent and be proactive in that too. Okay, anybody have questions? You could chat me, or you could stop me, or you can, does everyone understand this stuff so far? Okay, so this is the thing, is we have to understand that there's unseens and unknowns, and that's what this is. We don't know. There's unseens, grief, loss, and powerless. And so this is just an example. I have this in a couple other PowerPoints, of course. So it's an example of what's acute stress, what's adjustment, and what's post-traumatic. So that's the example of what different traumatic events are going on. So acute stress, was not COVID. The first month was acute stress, and we didn't know what was going to happen. And then after that, oh, it's just an adjustment. Well, guess what? We're past 6 months, and we've still been in it, and we're pulling out of it. So it's post-traumatic. If it hasn't been treated, if we still have symptoms from it, or that's an example. So the emotions of loss, grief, and powerless, and if you have a kid grieving, because we really, really don't understand that. I've seen lots of loss and grief, and we call it something else, and it's not. It's loss and grief. I just did a loss and grief in children under 12 that's on YouTube now, so that's another one. Okay, so roots. Why is this happening? And I don't even do why. I don't ever use the word, but this is why what people say, why is my kid still picking their skin until it bleeds, and then it's embarrassing, and then they go to school, and then we have to put band-aids, and then they never let it heal. So that's example. So the leafy issue of that is some pressure, some emotional disturbance, some being bullied, poor sleep and diet. Hands down, it has to do with sleep and diet. There's some phobias going on. We have thinking errors, we have fears, right? Lots of thinking errors going on for kids. And those are developed from our society. Kids don't come up with thinking errors on their own. They really don't that much. They come from society, from television, from gaming, from parents, from their friend. I have all these fears now that I'm going to die if this happens. Those are phobias, and those go into severe. We want to treat those. And then the secondary emotions from in the root. Okay, so here's the leafy issues. Leafy issues can change. But they feed the root if they keep coming back. Okay, so they keep feeding the root. That's why I like analogies. This tree, I use it for lots of different things. But the secondary emotion is really, I just feel raw because I have this pressure of perfectionism in my leafy issue about school. Lots of teenagers, and it's like fear, anger, betrayal. I feel hopeless. So then that keeps feeding the root, right? And what's in the root is loss, grief. Just talked about that. Trauma, developmental trauma. If there's developmental trauma, which is anything under the age of 20 something, because your brain doesn't stop developing until 26, then that's that's developmental trauma. And then relational trauma is parents getting divorced and people dying in their relational, time. So self-concept, abandonment, shame. You can watch my Shame Resilient Parenting. We just don't want to shame self-soothing behaviors. Now, especially, a teenager's cutting or a child is picking, and you're like, yeah, they're going to grow up just, always self-harming. And I don't want them to do that. And then you shame the child for doing it, like having an accident or wetting the bed. We've now added trauma to their life. That's all that I have to say about that. So chronic health and mental health disorders down here in the root issue. And this is, by the way, everybody, this is what we're treating. Okay. I'm gonna, yes, of course I'm gonna talk about the bully, but is that the real deep issue? It's not. It's never what is about what they come in for, what you come in for. It never is. I go deep because it's always something deeper. It's always something connected to something else. It's pre-existing beliefs. So pre-existing beliefs say it's not about the bully. Well, the bully just added to the pre-existing belief that I am ugly and I'm a worthless kid and I'm never going to have any friends. And that belief system was, added to by the bully. So he already had a pre-existing belief. And then it's like, wait, how do I change that? That's the root issue. And those are thinking errors too, they're thinking error stories, they're negative cognitions. So when we get into negative that's your self-concept in the basement here of this root issue. It's like basement, it's like down deep, And so if those things are in here, it's like, wait, I actually need to come in for abandonment because my child is self-soothing behaviors at night because he was abandoned and he has an attachment issue and he feels like everyone's going to die all the time. And they're talking, that comes into my office all the time. So, okay.
We have a question.
Yeah.
So it said, my son, who is currently 5, he reacts in anger and hits or punches daily. I have taught him some ways to calm down, such as taking deep breaths and counting or using a water glitter shaker. However, it doesn't seem to always help. Are there other suggestions to help that may be more useful? I would love to get him to stop hitting.
Yes. Okay. So these little things like, oh, you tried like the squeeze ball or the, the distraction, right? Or like, so the other part of that is rewarding when he doesn't. So we have to reward the brain when he doesn't hit. So let's just say we want to reduce, because you're never going to get rid of it, hitting, and especially self-harm or to someone else. So that's my bar. You can't hurt yourself or others because that's domestic violence. That's domestic in your own house. And you're having violence, which is I'm going to use when I get frustrated and I can't regulate my emotions, I'm going to hit. I am telling you, you change his diet and his sleep patterns, and that reduces. Number one. Number two, it's reward him when he's not doing it. And then it's emotionally coaching after that, number 3. So it's rewards of like, oh, and then something deeper is going on, right? It's not about the hitting. Something's deeper is going on. He can't regulate, what is deeper in that situation at that age, he can't process. So processing is up here. So he has a disorganized attachment, not to put a label on it. It's just a word. Just helping label some things, but not to put a label on him. So when we can't process, this is processing his self-talk. Oh, I should calm down. I shouldn't hit because that would hurt my sister. And I'm going to get in trouble and then I won't get my reward system at the end of the night because today I hit somebody or I hit the wall or whatever. And so the reward system is very vital every single day at that age. And then it's like, okay, helping him self-talk because he can't process it. So then we get further assessment though for why he's not processing that as much. Because when we're daily, that's not normal. So I always call normal, extreme, and very extreme. When we're daily outbursts of extremes, then we need more help. We need play therapy and we need to get him assessed. And he's not processing. So it's not he doesn't process. So what do? We go into the self-soothing behaviors that are on this side that are, not so awesome, self-harm. So let's go into trust and attachment and attunement. So here's trust. Trust is about attachment. We trust our own feelings, our own gut, our own body, other people around us, that they will take care of us, when we're little. So this is just a very glimpse of attachment, and you can look into Becoming Attached by Karen. I've got it right up here in this office. It's one of my early books. I didn't grab it, but it's right here on the shelf, but it's referenced in the back. And so becoming attached is very, very important at a young age. So this is just what's going on when you're insecure you're going anxious, disorganized, or avoidant. If you're secure, then, none, these attachment styles aren't happening. And then here's some empathy. This is a little bit of attunement. So empathy and attunement, when you're a parent, your empathy teaching, your empathetic parenting, that is your emotion. So this is all about emotion in this one. Self-soothing is all about regulating an emotion, which is activated from the nervous system too. So we're calming the nervous system because emotions come from there. Emotions are chemicals. Chemicals are set off in the body. So if your gut's unhealthy, if you haven't slept, you know how your chemicals are. Your emotions for the day. They're crappy. When we eat crap, we don't feel good. We have a cold, we're sick, our body's not attuned with, everything we don't feel good. And we're very not patient, or, we're burned out and we have fatigue. So the same thing with a child. So what do? We self-soothe. We watch Netflix for like 5 hours when we get home, right? Or, we eat, or, or we drink. We eat it, we sell it, we buy it, we drink it, and we use it. Those are the things that we adults do to self-soothe. We buy it, we drink it. Yeah. So that's just America's statistics, by the way. It's like what Americans do to cope is those things. So we want to go into empathetic attunement. Okay. So we want to attune with the child and bond. Remember, attunement is cues. We want to tune into cues. I see that I'll do a scenario. I see that you're picking your skin, and you sit down by the kiddo and he's like, oh, I am, I'm picking, oh, and it looks like you're bleeding. So what we want to do as guilt-stricken parents, which is just, it's okay, what we do, is we want to fix it. So we were like, oh, wait, let's put a Band-Aid on it. Let me fix it. Oh, don't do that. Let me put a Band-Aid on it. And we get a Band-Aid, and we go and just get a Band-Aid. That was not empathy, and that was not attunement, and that was not what the child needed. So we recognized, we did the first that we recognized, we went in and said, oh, you're picking your skin. Again, sometimes we say that, and then, my tone, I was a little bit of shame, a little bit of passive aggressive, like, what are you doing that for? And no judgment. Everybody does it. Like, really? Why are you hurting yourself? Why would you do that? And that's where we've gone wrong. The kid, that will just add to the child's emotional distress. So the other way to do this, instead of going and getting a Band-Aid, is doing the things that are on that list. So it's like, does this child just need to be snuggled? Do they need to replace the behavior a little bit? Oh, did you lose your little gadget that you usually spin and play with? And he's like, yeah, I lost it. Or you get a stuffed animal for him. It's not solving the problem. It's coaching the child into replacing it and finding something that will do the same thing for him. And then talking about it when he's out of that distress. Something's going on in the brain when a kid starts, picking. It's subconscious, but it's also something's going on, and we don't know what that is. I can't stress that enough. We don't know, but we just know that these things are happening in the body of I don't know what to do, and I'm just thinking about something, and they might not be thinking about anything. So it's very confusing. It's like we don't know, what happens when these things all of a sudden trigger, but we do know what happens to the body when we send it back to the rest and digest. The getting out the right into the right nervous system, right? So we want to calm that at night. What's happening is most of the time this happens at night. Kids wet the bed, kids kick and pull, and are anxious at night. So we've got to set them up for success with something to do with that. And those are the suggestions in the other PowerPoint. So this is a little bit more of about a tune. So John Gottman's and this is about this, of course, he's a couple specialist, he's a relationship specialist, but he also does kids and everything else. And the whole book that I gear emotional coaching on is from his book, How to Raise an Emotionally Intelligent Child. It's key to all this. But of course, he has all of his partnership. And I put this in here for this reason. Do you think an unhappy marriage, dysfunctional, abusive, bullying, displacement, domestic violence going on in the home is going to help attune and help the child self-regulate their emotions if they're witnessing and feeling that all the time or part of the time? It doesn't work. So attune to your partner, get both of you on board so we can parent the unregulated child. Because if they're picking, for example, again, they're not regulated. Also, they could be burned out. They could be, like I said, there's a million reasons, but they also, could have a gut thing and they need to change their diet. So attune to that. Check their gut. See if they're pooping. We talk about poop all the time. I do, because I listen to it all the time about not in practice, but in workshops and summits. And so it's like what's happening inside of our body affects our behavior. So I am telling you, if you attune to something and you kind of go get curious about the cues, the clues and the cues of your child. When a child is constipated, I promise you they will have 10 times more behavior. And you're like, well, yeah, I see it all the time. My kids constipated. They don't do this, they don't do that. I'm like, then there's a gut issue going on, and it's not just anxiety. It's not just anxiety. It's their gluten, it's their dairy, and it's their sugar. So those are the three things that we eliminate first. So if you eliminate some dairy or first, and then you eliminate some sugar and you replace with something else, just you're replacing. It's replacing the food that is most important. So, okay, we're just going to replace this with this and try that and see if it works with their behavior. There's just tons and tons of studies on it. So, and this is a little bit about the 5 steps of emotional coaching from Gottman. So the thing is we always go into the behavior, right? We always go straight. So the scenario I had before about, oh, you're picking your skin, let me go get a Band-Aid. There was zero empathy. There was zero understanding the emotion behind it. There was zero like, oh, it seems like you might be bored. And we jump right to the behavior. And that's where we got to step back and go, wait, we've got to not ignore the emotion. And the kid might not know the emotion. So that's where we coach the emotion. So those are the 5 steps. I have a whole workshop on it. So you can go through that later too. Okay, so tools. And we got a few minutes. Okay, so positive reinforcement. So this is the reward system I was talking about earlier with the question. Every little small reward, I always do that according to their love language. If you don't know what their love language is, take the quiz. I have a whole workshop on that. So it's like, it's getting there. So for older kids, it's daily monitoring of behaviors and emotions. So you can monitor the behaviors, but it's always about the emotions too. So this is like, okay, a behavioral diary, sure. And this is, but make sure you go into the emotions, which is later. So role model the non-judgment of the self-soothing behavior. You just, don't judge and don't shame the self-soothing behavior. Now, once again, even if it's harmful and they're self-harming, we have to, go into that, but we don't shame that. We model. I feel really good when I have a bubble bath after a stressful day. And it feels so good. You model that. It's always a scenario. And I never, I wasn't a theater major, but I can model and I can role play with clients and families and show them, it's like, you can imagine and pretend, and you can be like, oh my gosh, I love broccoli. Like, man, it just feels really good. I love it when I put oil, bacon in my Brussels sprouts because it takes out the bitterness. And now we love Brussels sprouts. Yeah, I'm telling you, I'm serious. You put oil and bacon and a couple other things in your Brussels bait. Yeah. My this is I'll self-disclosure. My kids' friends had never eaten Brussels sprouts until they came to my house. And they're like, they would tell their friends how good they were. And they've got to try them. And I have a confession. I would put a little brown sugar in them and saute them too. But when you put good fats in with your vegetables, olive oil, you know, avocado oil, bacon, grease, it is one of the best things for your vegetables to get your kids to switch. So we just add one little thing, to one of those things, and then reward them. So, yep. And so you've got to model that. So that was just my example of modeling. If you want to eat vegetables, and you want your kid to eat vegetables, and we want to change our diet in the household because it's gone to processed foods, then we need to model that. And then how to cope with stress. So redirect your kid, of course, redirect them towards playing with the fidget object we kind of talked about. Okay, so then the next part is encourage your kid to engage in activities that allow them to have sensory stimulation. Okay, that means your 5 senses, that means oils, that means gum in the mouth, something to chew, to eat, to smell, jumping jacks and running and boxing. All those are so we did paired muscle, right? P, and I is intense aerobic exercise. P is paired muscles, and paired breathing. We did that. These are tips. And so the other part of this is like 10 jumping jacks. So a fast aerobic exercise will get a kid's whole nervous system going and do a state change. So anything that you can redirect, of course. Oh, you know what? I think I really need to go on a walk. Who would like to go with me? You know what? And after we go on a walk, whoever goes with me is getting an ice cream cone, and we're going to go do some time, at this, or we're going to go get a snow cone. And yeah, I promise you, someone will probably go on a walk with you. So, I don't promise anything. Just therapists don't promise anything. We just pretend that we know what we're talking about. But yeah, I mean, it's entice and invite. That's all we can do, and we can model. But we seek understanding and without judgment and shame. We talked about that. We attune to their physical and emotional needs. Okay, emotional coaching. We talked about diet improvement and sleep. We talked about watch my sleep hygiene workshop. It was one of my favorite ones to do because I needed it on there to send people to watch because it's so important. And I only put one YouTube one down here, and that is the emotional coaching one. But if you go to YouTube, under Blomquist Health, the videos are on there. And the sleep hygiene one's on there. Okay, so to wrap up, this is how we improve the moment, right? So this is just one more way to be present. So back to this slide. We'll go back. So how do we be physically and emotionally present? Okay. How do we be physically and emotionally present if we don't know how to do that? Well, these are some things. And there's imagery and meaning and prayer and relaxation activities. And one thing in the moment is finding one thing in the moment. What do you smell? What do you see? What's going on? That's what you find your kid in a non-present, subconscious, reactive behavior, for example, picking. That's what you say to the child. So I see that you're doing that. Okay. Is there something that's in your room that you would like to play with? What can you pick out that's blue? And you find something in the moment. Okay. And it's not redirecting, it's not taking away the self-soothing, because remember, this child is trying to self-soothe something. So we want to replace it eventually, yes, because if it's a problem, right? And some self-soothing things are a problem. You can't continuously have accidents at school or wet the bed throughout your life. So we've got to figure out what's going on with the nervous system. And relaxing activities, we've done that in actions, right? Relaxing actions. That's a bath, that's breathing, that's going for a walk. But the part about this nurturing the soul part is where I go, is that's deeper. Your mind, body, spirit, soul is what's empty when we're self-soothing harmfully. If we are harming ourselves, there is something empty in this. It's not just the mind, it's not the body, it's the soul. And so you can go deeper with that, really learn what that is. And of course, we're reading this book, Caring of the Soul. I didn't put that in the references, but that's why it's on my mind too, because I'm always, whenever I'm listening to a reading, it's always very surfacey, which is a lot of things. So using depth, value, and heart. So how do we experience life? How do we be present is that. And we can't be present with our kid if we're not experiencing life as our own model in depth, value, in our heart, right? With meaning and imagery, and you got to go on vacation. Yeah, so that's the improved part. So I am good to, let's do some questions if there's any, and have a little discussion if anything. So here's the references. Bowlby, of course, is the attachment. Yeah, he's the one that coined that. And Gottman, 45 years of research on relationships and how to emotionally coach a child. And that's Karen is the becoming attached, and Perry, of course, is the he is so let's see. So he's one of my favorites too. He has lots of books on Bruce Perry. I've seen him speak in summits, and he does a lot about trauma and maltreatment, attachment, kids, And then Siegel, he's in my top 10 authors. My top 10 authors. He's definitely in there. Siegel is he has Brainstorm, he has Whole Brain Child. I have like about 6 of his books. He is a psychiatrist, a psychologist, a child brain psychologist. So he just has great books about the brain. So he's just phenomenal. I've seen him multiple times in attachment summits, and in other ones I've seen him speak in multiple times. He has got great books.